So while we're one of the things while we're sorting through the cards, I have a session I call Fact and Fiction. As I mentioned, we collect these cards after every part of our conferences, and we actually put them all together, so we get an idea of there's some common questions that come up through many of the ones that we had. So to kick things off, I sort of start with some of the common questions while we're collating the questions on your card. So this is for Terry, and this is a common thing. Medicines and drugs. There are a ton of these ads out there. I've seen them everywhere. CVS and there's the garlic and the oils and the glucosamine sulfates, and there's all kinds of stuff out there separate from the medicines that you talked about. So what's their role, and how do they fit into the treatment of arthritis?
Right. If you go back to what we were talking about of looking at the mechanism of trying to understand, what the best way to treat something is so we have to look at what the underlying process that we're trying to influence. So if we take a look, for example, at cartilage, remember cartilage, it doesn't have any blood supply. It's very slow in its turnover. If we look at, for example, the chondroitin and glucosamine as a precursor of parts of cartilage and of part of that of the other materials there, that I give the analogy of this. When my grandmother used to come visit, I have 3 brothers, she would come down every morning and had a bottle of unflavored Knox gelatin. Remember unflavored Knox? And she would take a heaping tablespoon and put it in each of our orange juices. And she would say, look at us, and she would say, Terry, that will make your fingernails grow. Remember? And so I don't want to ruin Jell-O for you, but it turns out that the gelatin comes from calves' hooves, and so that the thought was you take the calves' hooves, you eat it, and it goes to your fingernails. Well, it turns out that that's not exactly the way it works. In fact, that's not how it works. That if we look at certain disease mechanisms, there is a deficiency state, like iron deficiency anemia. If you have a low iron, you take the iron, it goes in to your body, into the bone marrow, and helps for you to for your cells to function properly. We know with osteoporosis, we need to take enough calcium. We now know we need certainly enough vitamin D is another big component that helps. But in terms of our cartilage, everything there in our cartilage is synthesized locally by the little cells, are called chondrocytes. And so as to whether any of this, Tony, gets into the cartilage or not is very problematic. And glucosamine and chondroitin actually really are not directly anti-inflammatory. And so, and if we look at where they come from, the glucosamine comes from lobster shells. They grind them up. And chondroitin is from calves' tracheas. They grind them up and put them into a little capsule. Now, there are other ways of making them. The bottom line, though, is that there was a big study done by the NIH, and it showed that there was really no evidence that glucosamine or chondroitin insignificantly influenced the disease process. So the answer is, here's the bottom line, things that work, you have to, as we've heard today, you've got to look at not over-stressing your joints, joint protection. Number 2 is our muscles are the major supporting structures of our joints. We have to keep them strong. I'm embarrassed to tell you, we do osteoarthritis of the knee exercise studies. And strengthening your joints with proper exercise is extraordinarily helpful. So we have to have balance, rest, and activity. We strengthen our joints. Our medicines do work. We really try to balance medicines. And then certainly, as you've heard, surgical intervention, when indicated, is extraordinarily effective. Like any questions, when you don't know the exact answer, it takes a lot longer. So,
LaDonna, did you try any over-the-counter supplements or anything as part of your treatment plan before surgery?
It's really hard to remember, but I think I did. Actually, my dog benefited from glucosamine chondroitin. And I don't know, actually I did try to use it, and I didn't know if it really made a difference or not. But it did make a difference for my dog because one level didn't help him at all, but a higher level, and I figure he didn't know too much about the placebo effect.
I would only answer that, and I don't disagree, but you have to look at studies have really been done. There were in the study there was a 30% placebo response in the study, which was unbelievable. You know, taking something, and I'm not against the placebo response. I mean, our body it tells you, and the message to take away is that the body has a tremendous healing capacity. We have to help understand the problem, and then we want to use effective measures that impact those disease mechanisms. You know, I'm not sure why the dog feels a little bit better, but there it was.
Well, and I think the important point, too, as mentioned, is we are, in these particulars, we are treating pain. So we tell our patients, whatever you can do to get your pain under control, and sometimes that could be also, you know, we always tell patients pain's very subjective, right? Everyone always talks about different pain tolerances. You know, sometimes people have very high tolerance, sometimes not. And so we're really treating pain. The only other word of caution with this whole area, that you have to remember that if it's an over-the-counter item, the FDA does not control anything in the advertising, okay? So unlike Celebrex and Aleve and Motrin and all the ones we typically use, they're controlled by the FDA, and that means they're controlled about what they can advertise and say about them. But if you're a chondroitin or a fish oil or anything, it's considered a vitamin. So those manufacturers can say whatever they want. You could say it cures arthritis, which they say. You know, if you ever look at some of the magazines on U.S. air fights and things like that, they can say completely different things. So the first question in your mind, you should always say, you know, is this an over-the-counter vitamin category kind of thing, or is this a true medicine at the FDA? And then you can take into account, you know, what the people are telling you with that. So maybe another follow-up to that, Terry. What diets are favorable for cartilage formation and maintaining healthy bones, or if there is any diet for arthritis versus osteoporosis?
You know, the most important part, I mean, we need to eat well. You know, in my dentist, as I was growing up, I was telling this story the other day, and he had that old drill. Remember those old drill before? Oh, my God, it used to torture us. And I remember looking out, and he had a sign that said, "You are what you eat." And that is true. And so we have to eat well, and proper nutrition is important. But one facet of it is we need to take a look at the influence of our weight on our joints. For every 1 pound of body weight, there are 4 to 8 pounds of pressure placed on our lower extremity joints, a tremendous amount of multiplying effect, which you can look at in reverse by decreasing our body weight to the ideal. It significantly decreases. Tony, that right now, there have been studies in rheumatoid arthritis. There is no evidence that any diet alone has any significant impact on arthritis.
And again, you have to think of arthritis and osteoporosis. They're two different disease processes. So with arthritis, there's no real dietary benefits other than watching your diet with the weight loss, as Terry said. But in osteoporosis, that's not true. Because remember, vitamin D, calcium, all the different kinds of things that are necessary for maintaining healthy bones is very important. So diet does play a role in the treatment for that side of it. Exercises. One of the this is also the part of the fact and fiction. You know, sometimes patients come in and said, you know, doc, I heard exercises are not good for someone with hip and knee arthritis. Meg, how would you answer that? You already did, I guess.
Wrong. No, exercises are definitely good, but as someone stated here too, there needs to be a little bit of rest involved as well. Obviously, you're not going to exercise all day. So just become educated and figure out what works for you and what you're most comfortable doing.
And, you know, hip and knee arthritis or any arthritis, remember the things that you do that are impact. You know, like the jogging you used to do or the pounding kind of, those are what drive arthritic joints crazy. So I think what happens is patients are thinking about those kind of exercises, but you have to change your mindset and think about doing low impact, aerobic, smooth kinds of exercises. You know, LaDonna? Sure.
Yes, could I add a couple of things? One is about a treadmill and the other is about an elliptical rider. I think that overuse of a treadmill exacerbated the problems that I was having in my knees because of the constant pressure and impact. But when I switched to using an elliptical